All right, thank you very much. I appreciate it. For much more on the healthcare overhaul and all the business taking place on Capitol Hill, Republican Congressman Brian Bilbray of California joins me this morning from Washington, D.C. Congressman, good to see you.
Honor to be with you, Alexis.
So I'm sorry I had to stop there because I wanted to make sure I got that right when I just watched the replay of Senator Max Baucus. What's going on here? Because even Democrats are starting to get really skittish about this.
Well, reality's hitting in. I mean, you know, Alexis, if you ask the American people, do you want to have free health care? Of course they say yes. It's like saying, would you like to have a free home? And of course, the great majority say yes. But then if you ask the average American, would you like to live in public housing, they would have a second thought. And this health care issue is a major question about quality and cost. And now with the CPO, Ms. Pelosi's own organization saying that the proposed plans will not only not lower the cost of health care, it will increase it. So I think we really need to look at that. You know, I was a county supervisor, chairman of San Diego County, and provided health care for 3 million people or have to supervise the health system. This is not as simple as people think. And maybe what we should start with is how do we get the two components of health care that do not provide services, insurances and lawyers, out of the system and put more emphasis on quality and service rather than the backward way we're doing it. So I think that they're running into a reality. There's a reason why this issue has not been jammed through or tried to be crammed through before, and I think they're running into reality.
So does the CBO report, does it really, I guess, put a nail in the coffin to the latest House bill, which is expected to go through 3 committees and make it to the floor? Is that done as we know it?
No, Alexis, for one big reason. There's an agenda that has been waiting for a long time to implement. You've got a lot of people in Washington that have been waiting 20, 30 years to try to jam a single-payer government nationalization of the health care system through, and they see the opportunity as now and within the next few weeks. They don't want anybody to read about it. They want it to be so large that details cannot be reviewed. So I don't think facts are going to change the radicals on this that have been waiting and think they have to do it now no matter what the cost. So I think that's the real problem you run into. A lot of people are thinking that you either do it now or you never do it, and who cares if it's the right way as long as you get it done. And that's a scary concept for a country that's responsible for 350 million. This will be the largest health care system in the history of the world except for the Soviet Union, and we saw what happened there.
Let me turn the table for you just a moment. Mark Zandi from MoodysEconomy.com, he's been consulting a lot with the administration, and he basically says, listen, these are tough choices, but we've got to do something now. Because if we don't do something now about health care, Medicare, Medicaid, they will be, in essence, the next financial tsunami. So what is the solution that will not involve taxing the wealthiest, many of which are the small business owners, yet will do something about the 45 million uninsured?
Well, first thing you do is you don't take on more debt and make more promises than what you can already pay for. And right now they're talking about not just $1 trillion, but looking over the horizon at $2 trillion more debt over on top of. So I think we've already seen what happens when individuals take on more debt than they can afford. I don't understand why Washington thinks the government doing the same thing is somehow going to pull us out of this. I worry about that more of this is talk about let no crisis go unexploited than it is to seriously look and say, look, the tort system in this country is a huge expense, not just by what shows up in the courthouse, but all the procedures that are done by doctors and hospitals just to be defensive. I think if we're not serious about saying there's got to be a better way to do quality control than have judges and lawyers work it out, go from litigation to mitigation, if we're not willing to take that step, I don't think anybody's really serious at reducing the cost. All they're really serious in is expanding the footprint of the federal government in our society. And I think that's a concern we should look at.
All right, Congressman, to be continued. Thank you so much for taking the time to join us this morning.
Thank you very much. An honor.